And speak to Tess Ingram, the spokesperson for the UN Children's Agency, UNICEF. Tess, welcome to the programme. You heard possibly Ashraf there saying that without a ceasefire, how is it possible to administer 640,000 vaccines?
It's nearly impossible, and we've been saying that it's why we're calling for a ceasefire, or at the very least, a polio pause of 7 days in 2 parts for each round of this vaccination campaign, so that we can try and do our best to run a safe and effective campaign. But with the logistical challenges on the ground, with the ongoing danger and fighting, it's going to be really, really hard for us to curb the spread of polio, to save children's lives, not just in the Gaza Strip, but in the region, because polio really doesn't respect borders.
What are your colleagues in Gaza telling you about these latest evacuation orders? We heard from Stefan Dujarric at UNHQ in New York saying that all of the specialized agencies except UNRWA are unable to operate right now.
So UNICEF is staying and delivering. We are continuing to operate in Gaza. However, as Stefan said, the ability of the UN system to operate is becoming increasingly constrained. A number of other UN agencies have had to evacuate their guest houses. As we just heard, warehouses are in areas that are inaccessible, and we're still struggling to get aid into the Gaza Strip at any meaningful scale. So it is an increasing humanitarian catastrophe, and these are the conditions in which we're attempting a very ambitious vaccination campaign. So we're not going to give up. We are continuing to try, but it's getting harder by the day.
Tess, you'll have seen the numbers. I just want to repeat them for the viewers before you come back. In terms of physical food deliveries, there haven't been any to northern Gaza for the past 3 months. For the south and center of the Strip, the levels of food deliveries are the lowest they've been since July. Because you work for UNICEF, you must be speaking to parents. How are parents dealing with the hunger that their children are experiencing? Are they not eating themselves?
Yes, we've been speaking to parents, and in fact, we've done surveys right across the Gaza Strip, and we see parents trying to find coping mechanisms to feed their children. That includes not eating themselves. That includes trying to find alternative sources of nutrition, maybe leaves, plants from the ground, maybe animal fodder. Particularly, we've heard that in the north of Gaza. So it's really becoming dire, and we thought that it was bad months ago when we started issuing warnings about the increasing levels of childhood malnutrition in Gaza, of children dying from malnutrition and dehydration. And then since then, the amount of aid that we've got into Gaza has dropped by half. So it really is desperate now, and people are running out of options.
Are you at UNICEF finding, I presume, the same as the World Food Programme, which says that apart from the fighting, the amount of damage done to the roads of Gaza, which the Israelis have been also doing in the occupied territories, whatever their purpose for that kind of action is, the WFP says soon it may be that the roads are so damaged that we literally can't get to people.
Yeah, that's right. And it's not just the roads, it's also damage to other infrastructure like warehouses, like telecommunication systems. But the roads are a real problem. And I know across the UN, we've made some attempts to help repair the roads, but it's very difficult in the midst of constant shelling from the skies. Our teams continue to be put at risk, and we don't always have access to the areas where we want to go. This humanitarian deconfliction system that we've talked a lot about, which is where we inform the parties to the conflict where we're traveling so they can try and protect us as we move, that is still not working either. And so we're not moving where we need to go. We're having difficulty accessing places. And even if we do get the clearance, the roads aren't working. So it really is like snakes and ladders. We make 2 steps forward and 3 steps back.
Tess Ingram, thank you so much indeed for your time, Tess. Really appreciate it.